Dr. Caporusso, can you describe how poorly controlled diabetes affect your feet?
The foot is kind of like a mirror of the body, of all the effects of diabetes on the body. We see them all on the foot. We've touched on a couple of them today: the poor circulation, the PAD, peripheral arterial disease, which many times can wind up in gangrenous digits or toes or feet. We see ulcers that don't heal because of the poor circulation. Another thing that's affected by is the nervous system, the nerves. The high glucose, increased hypoglycemia, uncontrolled diabetes affects the nerves. And it comes to the point where the foot is anesthetic. And there are people that walk into our offices with nails sticking in their shoes that they don't know it's there, other than the fact they have bleeding all over the place and they don't know where it's coming from, other than they see a hole in their foot. And so the neuropathy really plays a major role in the different side effects that diabetes can cause on the foot, the ulcerations, the infections that occur. And we admit people all the time with large ulcerations in their feet and have no feeling. They feel fine. They feel like they can go and do a marathon, but they have a large hole in their foot. So the PAD is really important, the neuropathy, and also the musculoskeletal effects of diabetes. The neuropathy affects the innervation of the musculature and the different bones and things. And what happens is you have a breakdown of the bones without any type of trauma, just walking normally, and people start having swollen red feet. And many times it's misdiagnosed as having an infection in the foot. But what they have is called sarcoarthropathy. And basically it's a breaking down of the bones, a fracturing of the bones due to the insensate foot, the lack of sensation in that foot. And so the nerves are affected, you get the neuropathy, that's how we get ulcerations. Number two is the PAD, the poor arterial disease, peripheral arterial disease, where you have poor circulation that doesn't allow them to heal. And number three, you get the biomechanical problems, the breakdown of the bones, the deviations, the bunions, the hamartos that are occurring because the musculature, the muscles in the foot are not being innervated by the nerves. So we see all three of those things happening in the foot, which mirrors everything else that's happening in the body.
And how do you diagnose the damage in the feet?
Poor circulation, of course, we palpate the pulses. We look to see, does the patient have a pulse? There's two major pulses, one on the top of the foot, one by the inside of the foot that we palpate. We also do what's called capillary refill, where we push on the end of the toe. We see it blanches, it gets white, and we let it go. Does it get red again? One of the most ominous signs of having problems with circulation is when you take your toe and you push on it, and it kind of crinkles like an over-baked potato. You know, if you put your potato in the oven too long, it's shrunken up, right? We call it the baked potato sign. When that happens, that's a severe indication that the circulation is not very good. As far as the neuropathy, we use what's called a Semmes-Weinstein monofilament, which looks like a piece of fishing line that's calibrated. And we test that to see if the patient can feel you touching them with that piece of filament. If they can't, then that's another indication of neuropathy. Of course, we ask patients, do you feel pins and needles? Do you feel like your feet are numb? Do you feel like you have ants crawling on your feet all the time? And then sometimes they have severe painful diabetic neuropathy where they feel like someone's sticking with a knife every time they just walk or move. And so that's how we diagnose the peripheral arterial disease and the neuropathy. And then we take them through some biomechanical exams. We move the foot, we check for swelling, we check for redness, we check their x-rays to see if they have any fractures that they're not aware of. And that's how we do those. We check those three things. Good control of your blood sugars leads to less complications. The higher your blood sugar, the more chance you have of complications, whether it be bad circulation, neuropathy, lack of sensation, or breakdown of your bones. So first thing it's important, as we all said and we'll say tonight, you have to control your blood sugar.